Ben Tyrell, I'm the CEO for Big Sky Care Connect, the state health information exchange for Montana. The general construct for us is to be able to serve kind of three major groups. We want to serve the providers, we want to serve the state itself and those who fund healthcare in the state of Montana, and mostly we want to benefit the patients and citizens of Montana who are receiving care by allowing providers to have access to information at the point of care when they're delivering care to patients who otherwise would not be able to access that information as patients move through their different health systems or are traveling and have incidents come up while they're traveling while they're in the state. So, in our state, which is a very geographically large area with not a lot of people, people do tend to need to travel fairly large distances to receive care, particularly if they need more specialty care or higher level care. And so when a patient is traveling between those systems and they arrive at not their home-based healthcare system, those providers oftentimes don't have access to their medical history, particularly if they're in a crisis situation or in more of an urgent care situation. The providers don't have access to that information of what their medical history is, what their needs are, what tests or what information may have already been done. And so having access to that information when a patient arrives gives the providers the ability to actually have access to their full set of information, understand what their medical issues have been, what treatments have been provided, so they can provide the most appropriate care and deliver the best outcomes for a patient at the time. So, Big Sky Care Connect is one of the newer health information exchanges for a state in the country. And so InterSystems has been our key partner from our earliest stages. They're our original technology partner. They provide a full suite of services for us to deliver the entire construct of our health information exchange. So, we've been partnered with the state of Montana as, our key supporting partner in our state Medicaid organization. And our original funding came under the high-tech funding from through the federal government and through CMS. And so when that funding expired at the end of October, the end of September 2021, we applied for new funding through our state Medicaid office, through the Medicaid Enterprise Systems funding through CMS. And through our partnership with them, we were able to be one of the first HIEs in the country to get funding approved through that construct. So it's part of our partnership. In our state, we have three groups that participate in funding our organization. We have our state and federal partners, we have our provider partners, and payer partners. And so this has really solidified our partnership with the state and with the federal government to keep our ongoing design, development, implementation phase moving forward. So for us, it allows us to continue to build out our infrastructure and our network. And so we're about halfway through kind of building out our network and putting together our full technology platform. And so this gave us another 2 years of funding to help support that continued development and growth, so that we can have a full suite of technology available and full set of information to support our partners. We have four kind of major areas that we're focused on from a service set. So we have our clinical data repository, which is partnered through InterSystems with their health share technology as our platform. And that serves as kind of the core foundation for everything else that we do. And that clinical data repository is what allows us to deliver that basic set of clinical information to providers as we work through that. We're additionally working on providing event notifications, so alerting. So if patients are admitted, or discharged from organizations, we're able to provide custom alerting to our partners. We're also working on a diagnostic image exchange partnership, as well as a data analytics platform that we're building out. And that's kind of our current set of focuses for what we're building out. Initially, our organization started off with no employees. We were kind of a board-run organization, and InterSystems provided kind of the initial technology base and technology platform base for us to build off of and grow from. Since then, as we have continued to grow and develop our strategy and learn what it is that our partners need and how we move forward with that, InterSystems has been a key piece of helping us determine what the technology resources are that we need, how we can implement them, how they can be developed, how we need to tweak kind of what we have or what we need to meet the needs of our state and our partners. Data is really the foundation of everything we do. So building out that clinical data repository, making it as robust as possible is the core foundation. What happens next is kind of the fun part of what we get to do with that data and how we can deploy it in really meaningful ways for a varying set of interested stakeholders. And so we're working with clinical and quality improvement organizations to look at ways we can apply data for them to use to improve outcomes in care. We're certainly deploying it to providers in their hands, working with our state public health entities on ways we can help improve processes and practices as we've worked through the pandemic and learned about some of the gaps that exist in our public health enterprise. There are a lot of ways we can utilize data to help support and drive system changes that will make substantial improvements in people's lives. So we actually just went through this exercise last week with one of our partner hospitals was forced to close down for a period of time due to risk of flooding. So we reached out to other hospitals. Unfortunately, we don't have our full network built out yet, but we do have some. And so part of what we're able to do is offer even temporary access for those who are not participants with us to be able to access information. What we're really working towards is building our infrastructure into the state emergency preparedness planning. So for the future, should other natural disasters and when they occur, we would be in a position where our provider partners wouldn't have to worry about distributing medical information to new providers who are taking care of their patients. They'd be able to access that directly and easily through us. I'd say the most important one right now is the public health integration and how we can support it. In our state, a lot of focus on our data modernization for our state public health enterprise. We have 59 separate counties that each have their own public health entities within them, and being able to help create an infrastructure to support all of those counties, some of which are pretty robust and have fairly strong public health entities within them, but a number of them are really small and have one or two people who may not even be full-time deployed to those functions and have not had a lot of technology or any technology resources to support their work. And we're really looking at ways we can provide that basic infrastructure to support those enterprises. And then the other group that we're really focused on right now on building integration and collaboration with is our tribal health programs and ways we can help connect those entities to the non-tribal healthcare providers that also support their patient populations and their residents. I'd say the biggest thing is the openness to collaboration and listening to us when we have our meetings and our calls. Oftentimes I tend to push buttons. When I see things that aren't really working for us, I don't come from a technology background. I come from more of the provider administrative user side of things, so that's the lens I tend to see things through. So in my mind, everything is doable, because it's all zeros and ones, and it shouldn't be that hard. But yet, when you apply that technology into human interaction and human interface, that's when things get messy and get challenging. And it's been great to work with the InterSystems team as we see from our business side and from our user side what our perspective is, and to have that collaboration and willingness to work to tweak things or work through processes, find different ways to make the technology really work for our organization and, more importantly, for our customers.